folks, a very warm welcome today. My name's Richard Cash. I'm Head of Service Development at 360 Edge. If you haven't come across us before, we're a specialist alcohol and drug consulting organisation. We provide a range of services to the drug and alcohol sector and also to adjacent sectors, shall we say, mental health, homelessness, forensic jurisprudence. Our passion is translating evidence into excellent practice, and in particular, making sure organisations have got the tools they need to do fantastic work and great outcomes for their service users. Some of the stuff we do, we'll be talking about today, helping organisations plan, consolidate and build for a better, brighter, well-funded future. We also do a lot of service development work. We help evaluate, we help develop models of care for services. We provide policy advice to organisations, sectors and governments. We also do quite a bit of workforce development work, but the topic of today's webinar is how to win tenders. The steps and stages that an organisation should undertake in order to make sure that they can get the resources they need to do fantastic work. Before I introduce our panel today, I'd like to acknowledge the traditional custodians of the lands upon which we meet today. 360 is a remote organisation, but worth calling out the Ngunnawal people, Sarah's home in the ACT, where this work is localised. For me, Wathaurong people, south of Geelong in Victoria. We acknowledge traditional custodians and their connections to land, sea and community. We recognise the ongoing impact of colonisation and dispossession, pay our respects to elders past and present, and extend a very warm greeting to any Aboriginal or Torres Strait Islander people that are joining us today. Definitely joining us today, and two people I'm very happy to introduce to you is Sarah Ahmed, the CEO of Hepatitis Australia. Welcome, Sarah. And my esteemed colleague, Dr. Amanda Davies, Principal Consultant at 360 Edge. We've got a reasonable amount to get through today. I'm going to hand over to Amanda and Sarah to tell you a little bit about this piece of work. But what I would say, folks, is if a question or a comment pops up as you're working your way through the webinar with us, please feel free to stick a comment or a question in the Q&A box in Zoom, and we'll make some time at the end, and the panelists will answer your questions. And in fact, you can question their answers. Without any further ado, Amanda, Sarah, over to you.
Hello, hi everyone. I'm Sarah Ahmed. Like Richard said, I'm the CEO of Hepatitis ACT, signing into this webinar today from beautiful Ngunnawal land, as some others may call it, Canberra.
My name is Amanda Davies. I'm signing in from Larrakia lands of the Larrakia Nation in the Northern Territory. Sarah, do you want to jump in and provide some context for the tender development work that we've done with you?
Yeah, so some background and context behind the tender development. In 2021, the ACT government began a recommissioning process where they decided to redesign service delivery through all health and human services organizations in the ACT. And our sector, the bloodborne viruses and sexual health sector, was the first to go through with it. And for many of us, this was the first time in decades that long-standing services had to reapply for their core funding. And it was the first time the government sexual health and procurement team had run such a process. So in many ways, we were all learning together. It was a confronting process. We were all uncertain. It was high stakes, and frankly, it was daunting for us. It was an existential crisis for us organizations. but it also gave us the chance to take stock and show funders that we were serious about growth and accountability. And we had to really take a step back and do an honest assessment of where we stood before we even thought about writing our tender. So then, with the support of our board, we decided to take a critical look at every part of our organization, which meant we looked at our programs, our governance, our systems and partnerships, and we realized we needed help. So then we brought in 360 Edge. We'd worked with them before, so there was already trust. But importantly, this was before the actual tender application even opened. We wanted that external perspective to show us both our strengths, but also any blind spots that we may have.
So yeah, we partnered with Hepatitis ACT, and our first job was to undertake a significant gap and map exercise. So we looked at all of the funding agreements, and we looked at all of the programs and background systems that were supporting the programs, as well as the staffing model and the NSPs, secondary NSPs. And we kind of looked at that the Health Directorate of the ACT government had developed a massive needs assessment, which laid out in quite a lot of detail the key focus areas for the tender. So we aligned, when we undertook our map and gap exercise, we looked at where there was alignment and where there was some strengths and where there was some limitations. And we identified opportunities to fill those gaps and opportunities to build strengths and capabilities in some of the areas related to the needs of the upcoming, yet to be finalised date for the tender. We looked at data systems and data quality. We looked at organisational risks, including things like the location of the organisation and their lease arrangements. We assessed the skills of both the organisation and workforce. We reviewed all of the program areas, and we looked at the full range of service and support needs of the people who access Hepatitis ACT services. Specifically, who were the underserviced populations, and importantly, we described current reach and impacts of the full range of programs. And we put all of this information into a document for Hepatitis ACT to review and to guide their work up until the tender development process.
So this one, hepatitis ACTs, and this was something that we came to, we realized with help from 360 Edge, where our bid lined up with ACT Health's elimination targets and their statement of priorities for hepatitis B and C. So with this one, we used their language and their priorities so that our tender read like a solution to their goals and not just our goals. So in order to facilitate this, we went to every briefing session, every networking opportunity, just to listen and piece together what the directorate was really looking for. And it's not always in the tender document. Sometimes you need to understand the backstory, the needs analysis, the data modeling, and the strategies that sit behind the tender. We made calls, we asked questions, and we joined conversations to fill in the gaps. And I believe that context was critical when it came to the tender development part of it. It was also about not having an ego in place. We had to leave our ego at the door and say, we don't understand why this is happening, and just asking the questions and not pretending that we knew everything.
Yeah, and I think understanding that backstory and keeping, so as we developed the issues paper, then very soon after that, there was a date set for the tender. So Sarah was networking locally in Canberra and with all of her service networks and with the department to gather intelligence. And then we start to set up the tender development process. And we met with Sarah routinely to get that input from that background information that she was gathering. And it really helped us inform how we would present some of the tone of some of the information that we were developing in the tender.
This one, like I mentioned earlier, it was about asking questions and not being afraid to ask for help. We knew that this was an existential crisis for the organization if we weren't successful with this tender process. So as the CEO of the organization, I sought strategic advice from our board, from Hepatitis Australia, from other state and territory hepatitis organizations, and from our local service partners. But the tricky part of this was that some of those partners, those local partners, were also competing for the same funding. So it was a tricky balance, but I led the overall process, but handed the tender drafting to 360 Edge, and my job was to sort of be the bridge, as in keeping the board, staff, 360 Edge, and the directorate and our tender development in sync. Would you say that, Amanda? Yeah.
Absolutely agree. And the big issue that's probably not been mentioned is that you had just started in this role. So this was a massive task for you to inherit as you orientated to your new role. It was a really big risk, but tasks were delegated across the 360 team and the Hepatitis ACT, but Sarah was the conduit across everybody. We examined the tender document in quite a lot of detail and identified the key information sources that we needed. And we also looked to national and local policy and strategy documents. And we also did the practical stuff, who's doing what, by when, and we tracked that through the whole development process. And we scheduled weekly check-ins with Hepatitis ACT. And so we could Hepatitis ACT were obviously feeling quite anxious at the risk of losing funding after 25 years of operation. So we wanted to ensure that Hepatitis ACT were routinely updated with the progress of our work and things that we needed just to kind of bridge some of those gaps in information sources.
Yeah, and it was like Amanda said, it was definitely a very stressful process for us, but having that structure and a trusted partner really mattered to us. Having that document which told us what we needed to do and by what time kept us accountable and kept us to a timeline. So definitely having a structured approach was the key in a successful tender for us.
And bearing in mind that Hepatitis ACT were having to deliver services at the same time as this, so that's a lot to ask for a small team.
Yeah, and that was part of our honest assessment of ourselves, where we knew that we had some capability issues when it came to giving our 100% attention to the tender development process. We just knew that we would not be able to do that. So yeah. When it comes to sector leadership, so what we did at Hepatitis ACT was we didn't just describe the services, we positioned Hepatitis ACT as a sector leader. We knew that we were the only organization, only not-for-profit health organization in the ACT that was delivering Hepatitis B and Hepatitis C related services. So we highlighted our role in local collaborations, our national influence, our role in policy contributions, and we backed it up with evidence, letters of support from partners, data showing impact, and examples of where we were truly leading and not just participating. So once again, we were asking for help, and it wasn't a weakness. It actually showed funders that we were collaborative and realistic.
Yeah, and where there were data gaps, we were able to source data from some of the national research institutes like Kirby and Burnett and kind of bridge some of those data gaps and build that into the tender to see the alignment of Hepatitis ACT work against those broader data sets. So that was a really important part of the work. And we aligned all the aspirations that we were outlining in the tender with local and national strategies and the key focus areas that were identified by the Health Directorate in terms of the reforms they wanted to build into the system in the ACT.
Yeah. Funders want to invest in organizations that they see as leaders and not just service deliverers. You need to position yourself. So it was good that the recommissioning process sort of took 2.5, nearly 3 years, because we had time to really take a step back, look at what we wanted to do and what we wanted to be, and start acting like we were already that organization.
That's right. Live the aspirations before you get there.
Exactly. Decide what you want to do and where you want to be and just start acting like it. So But like I mentioned, the commissioning process was not a quick process. It started with a needs analysis, and then a roadmap was created for commissioning. So we knew that it was coming. We just didn't know when it would happen, and there were inevitable delays. But what that meant was, yes, it was really frustrating because there were so many delays. But the positive to that was that we had some breathing space to start getting ready, and 368 helped us see how important strong monitoring and evaluation systems are. I don't know how many not-for-profit organization participants we have here today, but that is something that I have always seen in my career, that monitoring and evaluation systems, we're not funded to develop them really well. We're funded to deliver services. So it was really good for 368 to tell us that you do need this evidence base and you need to have a good monitoring and evaluation system in place. So we could start setting that up. And we're still improving ours. But even then, we knew we needed data systems that tell the story of our impact. And by the time commissioning opened, we already had some of those systems in place. We already had some monitoring and evaluation happening. So from financial impact management to impact data, and that preparation time saved us weeks of scrambling. It's easy to tell people to be tender ready when we are actively service delivering, but if you're lucky enough to be in the, well, lucky, unlucky, I don't know, but if you're in the position where you have to re-tender for your core funding, this is absolutely something that you have to get on top of way ahead of time. Do not wait for the application to open.
And for all the work that we do around the country and the work with this tender, we know that funders want to hear data-driven stories. And it's really hard to tell data-driven stories if good systems aren't in place to collect your data. So it's all that backroom systems that really support a good tender. And we had been working with Hepatitis ACT for a number of years on that journey before we got to this point. It's really important. For this tender, we gathered evidence from other sources, as I mentioned before, to really bolster the response. And we looked at national monitoring and modelling and surveillance data. We also, things like having evidence that your MOUs are current and active and in ongoing review. So all of that backroom documentation to support best practice service delivery. So obviously when we had our meetings routinely, we would think about the audience for the tender. So we know that there's a lot of people sitting on tender evaluation panels who don't have subject matter expertise. And we didn't want for them to have to work really hard and do lots of heavy lifting to understand what they were reading. So we put a lot of time into thinking about making it easier for the evaluators to understand what Hepatitis ACT were asking for in the tender in terms of what they did, the impact of what they do, and their aspirations for what they want to do in the future. And I think it was very helpful that we kept keeping the tender panel audience in mind as we worked through well-structured, limit the repetition. There's a lot of repetition in tenders, as everybody will know, but we would say, see our answer to question 3, so we don't have to put it in question 4, 5, 6, and 7, and there's just that repetition all the way through. And I think, Sarah, you got some pretty good feedback from the panel.
Yeah, and I remember Amanda once saying, and I didn't even think about this, where she said, remember that they may be reading 30 applications in that 1 week, and that really stuck with me. And that's when I started looking at our tender from the eyes of an evaluator, because and Amanda was also the one who said, look, they may not be sector experts, they're just evaluating your application, so we need to give them enough information without repeating ourselves or overwhelming them. And that's when I realized that our job was to make their job easy. And that was reflected in the feedback. The director told us that our tender was clear and it was well structured and compelling. And they said that, they really appreciated us not repeating ourselves. So the cross-referencing, instead of repeating the same thing, really helped them. We aligned our responses directly with the criteria, so no one had to hunt for the information as well, and that was really, really helpful. And it was the results speak for themselves.
What were the results, Sarah?
Well, putting it all together, these 6 steps, right? It meant that Hepatitis ACT was able to secure long-term funding and double our resources, and it was transformative for the organization. And the best news about all of this was that these aren't secrets. Any organization can apply these principles, and I know for sure that I will be taking this experience with me through my career. And we were bold in our ask, but we backed it up with strong data, and we secured long-term core funding. We doubled our budget, but we also learned a lot, right? We learned that you have to leave your ego at the door, ask for help, trust the team, don't vent your frustrations to the funder, and above all, be pragmatic.
Yeah, it was a great outcome. We're all celebrating when we heard the news.
There was dancing in the office when we found out.
We were all pretty tired, but there was dancing. Yeah.
Yes.
We would have given it a bit of a shuffle, I think, as well, Amanda. The idea that you get more than what you asked for, Sarah, I think says something to your ability to persuade people, not just your historical impact to the territory, but your potential impact. Because you mentioned before, we were the only not-for-profit game in town providing these sorts of services. However, you did have potential competitors. There were other people that probably could have made a reasonably strong argument that they could have assumed some of the scope of work that you were doing. Folks, this would be a time to ask a question of our panelists. Possibly you're looking down the barrel of a upcoming tender opportunity, and this doesn't have to be the whole core funding existential situation that Hepatitis ACT found itself in. It could just be a simple project that you're thinking about renewing or adding a new service to your bow. So this is your chance to ask a winning team a specific question. A couple of things did occur to me as you were speaking, though, Sarah, and I'm wondering, there's kind of a underlying message here that even though this was stressful and fraught, this is kind of cut the blue wire, cut the red wire pressure. But I'm wondering, having gone through this, you've also mentioned it's been quite transformative for the organisation. If we were lucky to come in and do some more work with you in the future, what do you think we would notice is sort of different about systems or structures? You've talked a little bit already about your ability to track your reach, how many people you work with and through, the impact and outcomes, numbers about changed behaviour or reduced risk, or numbers of people tested and treated. These are all very measurable things. And partnerships, your ability to maximise the impact of other health and social service organisations. But I'm wondering, what would we notice if we came back in 2025 now? What would we see is different at Hepatitis ACT?
When I say transformative, Richard, it wasn't just about securing the funding. It's about how the process reshaped our organization. Like, yes, we doubled our budget, which meant more staff and more programs and more reach. But we were also able to, with the extra resources, we were able to build stronger systems for, and you will love this, data monitoring and evaluation. So now we can actually demonstrate our impact with evidence. We were able to invest time and resources in having those frameworks and systems in place. But most importantly, this allowed us to shift our mindset. So instead of being a small service trying to survive, we positioned ourselves as a sector leader, confident and credible and future focused. So yes, it transformed not just what we do, but how we see ourselves and how others see us. Does that make sense?
It makes
pretty impressive
absolute sense.
Sarah.
Question in the Q&A: where are legitimate places to find tenders coming up? And I will add to that, Sarah, maybe one of the things you do when you've got more staff is to allocate someone to keep an eye on places like, at a national level. AusTender would be one of the main portals where Commonwealth and national funding opportunities, grants, projects come up. Most states and territories would have their own health or sector-specific portals. And I would probably add to that too, for a lot of not-for-profit organisations, it's worthwhile looking at benevolent grant aggregators as well, and thinking about opportunities for usually sort of limited project funding from various places, which I won't name because it'll probably be a commercial in confidence issue. Amanda, you've been a commissioner of services. Do you want to add to that list of places where people could be looking for funding?
See, Commissioner. Yes, I think, you've got to register with all of the state and territory governments and with the federal government to be, and there's some criteria for some of them that you have to meet to be able to even register. So it's really a matter of kind of looking at all of the peak body websites, all the state and territory government websites, and some of the key national university websites to see what's coming up.
I'm not
Beautiful.
bound by commercial in confidence laws, but if this person who asked the question is in the community sector, the funding center is a good place. It's a national database, and you just sign up to their website. It's, I think, ourcommunity.org.au. But if you look up the funding center, sign up to their mailing list, you will get emails every single day, and they're not always necessarily national tenders. A lot of them are localized, but that's what I do. I keep an eye out on that for any ACT or national tenders, but also networking really matters. So a lot of times funders will signal upcoming tenders through sector briefings, consultations, and strategy papers before anything is officially released. So that's where the relationship can give you a head start. So you hear about priorities before they're officially announced.
Yeah, and PHNs as well, not to forget.
Yes.
PHNs, registering with the PHN tender. Each PHN has different tender links for their notifications.
Just quickly, folks, a couple more minutes to go. A fantastic question in the chat, though. Hard to look for the data internally. Sometimes organisations don't have an evaluation or research capacity internally to be able to do this stuff. Is it worth building partnerships with educational institutions or unis to better do this? And we've sort of name-dropped Burnett Institute very quickly through this, a very long-standing partnership with Hepatitis ACT. Sarah, talk to us about the importance of having some heavy hitters in terms of evidence gathering and impact demonstration.
Gives you credibility, right? The biggest thing is that when you have partnered with an academic organization like the Kirby Institute, University of New South Wales, Flinders University, these are the organizations that we've partnered with. It immediately gives you credibility, but also this is their bread and butter. These researchers and academics love data and monitoring, which I'll be the first one to say is not my jam. I don't understand it, doesn't make me excited. But if someone else loves it and wants to do it with you, then why wouldn't you partner with them? If you have the opportunity, I'm always an advocate for partnering because with research organizations or academic institutions, because it's a win-win for both of you.
Yeah, and most service providers have expertise in service provision, not in data monitoring and evaluation. So partnering with people who do is incredibly helpful.
You bet. I think the quid pro quo with my old research hat on is researchers are often looking for access to research subjects, which is the kind of the conduit that you provide. At a big level, a university or an institute like Burnett is fantastic, but sometimes someone like a health promotion placement student might be looking for a mini project, and they might greatly appreciate the opportunity to come in the organisation and help you answer a very specific question. There's probably kind of sector specific, depending on what you do, there would be aligned student training courses where some of their requirements will be around undertaking a mini research project. And again, those people are often looking for something real world and meaningful and impactful, and there's great opportunities for collaboration there as well. We are at the half hour, folks. Sarah, thank you so much, obviously for engaging us in the work. And thanks for coming along today and sharing the fantastic results you had. Dr. Amanda, again, always a pleasure to work with you. Brilliant work. I just also want to call out Dr. Katinka van der Ven, who did a tremendous amount of work on this tender, did a lot of the writing and a lot of the contributions around the data analysis. Unfortunately, couldn't be with us today. Folks, thanks for joining us. We'll post this video on the 360 Edge YouTube channel. So if you'd like to have another look or share the link with a colleague or a friend, and stay connected to us. This is a regular series, and we'll keep bringing you some insights around service development. Thanks very much, folks.